Hi, and welcome to Anatomy and Physiology Week 5 synchronous session. This week it's on addiction. So we'll be talking about different types: alcohol, smoking, nicotine, and then stimulants, and a bunch of other things like that today. First off, we're going to start with a picture of a healthy lung. And now we have a picture of an unhealthy lung. Traditionally, these lungs are smokers' lungs. The tar has created all sorts of scar tissue. So where the lung on the left is going to be kind of soft and pliable, the lung on the right is going to be really kind of hard. All right, so we're going to identify the effects of substance abuse on the body. We're going to examine the effects on body and body tissue. And the idea is that you can explain them after we're done. All right, so roles of different neurotransmitters. Serotonin. You'll see a lot of commercials for drugs that help with serotonin. Serotonin affects your mood, your hunger, your sleep, your arousal. If you don't have enough, it's linked to depression. And, so depression often means extra sleep. You can either eat a lot more or not eat at all. Arousal, you don't even feel like doing anything that's fun or anything like that. Some of the ones you see are called SSRIs, selective serotonin reuptake inhibitors, and that's what those do. They prohibit the body from reabsorbing all the serotonin it puts out. So it causes the body to hold on to the serotonin that's floating out there and let it build up. And then it creates a nicer cycle. You'll have enough serotonin and you'll keep that level up. Dopamine influences your movement, your learning, your attention, your emotion. If you have too much dopamine, often you are seen as or you could have developed schizophrenia. If you don't have enough, it's linked to tremors or things like Parkinson's disease effects, ADHD. And I do believe they're putting some drugs out there as well that focus on dopamine. Then you have acetylcholine, which does your muscle action, your learning, your memory. As those neurons deteriorate, you'll see Alzheimer's more rapidly. Norepinephrine, it's also called noradrenaline, so it's the partner to adrenaline/epinephrine. Helps control alertness and arousal. An undersupply can depress the mood and cause ADHD-like attention problems as well. And then you have GABA, which is a major inhibitory neurotransmitter, so it stops things from being transmitted. If you don't have enough of that, it's linked to seizures, tremors, and insomnia. And then glutamate, which is a major excitatory neurotransmitter involved in memory, which you'll talk about in one of your projects or discussions. I don't remember which. If you have too much, it can cause migraines and seizures. Used to be, they would cook with MSG, monosodium glutamate. It made meat more tender. Chinese food had it a lot. It created more of a savory flavor. And but now they don't cook with that, and so even when you season your meat, usually you're using Lawry's or some sort of seasoning salt because people have issues with glutamate in their food. What are drugs? All right, so a drug is a chemical substance that affects the physiological state of the body. One of the big things is it affects how the central nervous system works. They can be categorized according to whether they're legal or illegal, or by the type of effect they have on the body, although I would argue legality may be age-based. So stimulants, caffeine or cocaine. Obviously, cocaine is the illegal drug. Caffeine is the legal one. There are restrictions, not age-wise necessarily, but at health food stores for anything that has extra caffeine in it because it can overstimulate you. Depressants, things that are considered depressants, alcohol, and solvents. Alcohol is only legal if you're over 21, unless you're in Mexico, then it's 18. Solvents would be like paint thinners, spray paint, those types of things that people usually huff to get high. Painkillers, examples are aspirin and heroin. Obviously, aspirin is legal. It's not recommended for anyone under 12 due to a neurological disorder. I can't think of what it's called right now. And of course, heroin's the illegal one. You have the hallucinogens. LSD is one that's illegal. And I'm trying to think of a legal hallucinogen. Some of the painkillers can cause that. Performance enhancers, anabolic steroids. So they're man-made steroids. They act on the body to help you build a lot of muscle really fast. A lot of side effects. They are illegal. And there was this one WWE star, and he was taking anabolic steroids to stay all pumped up and so that he'd look good for his work. And one of the side effects of anabolic steroids is what they call roid rage. He ended up killing his his wife and his son, and then I don't know if it was the same day or the next day, killed himself, all because of roid rage. It really messes with your head. So it's better if you're trying to build muscle or enhance your performance to do it the natural way with hard work. Then psychoactive, they put marijuana on here. I think there's some that are probably worse than that. When I hear the term psychoactive, I think almost along the lines of LSD, things that give you an altered state. But alright, so we talked about depressants. Let's talk about stimulants. Stimulants speed up the activity. They increase the release of certain neurotransmitters at certain spots in the brain. So it can cause increased alertness, improved memory and endurance, raises your heart rate and blood pressure, reduces your appetite. Common stimulants include caffeine, nicotine, cocaine, and ecstasy. One of the reasons people, when they're quitting smoking, gain weight is because the nicotine in the cigarette has kept them from wanting to eat. Alright, so let's look at nicotine. It's addictive because it increases levels of the neurotransmitter dopamine. This is a feel-good dopamine. Helps you feel motivated, although most people I know just relax when they have a cigarette. Many smokers will find it difficult to quit smoking because of the withdrawal symptoms, which include headaches, anxiety and sleeplessness, weight gain. Yeah, it does a lot for them. What type of products are available to help smokers quit? So that's like Nicorette, the patches, the gum, Chantix, which is a prescription drug for quitting smoking. I'm not sure I would go for that one. Unfortunately, when you've been smoking a long time, you can have side effects. Maybe when you quit smoking, you don't have any side effects, but 6 months to a year later, all of a sudden you're having withdrawal symptoms. I'm not sure why it can occur that late, but it can. Now, if you look at the picture on the right over here, it shows the brain, and the blue dots are the nicotine. Stimulation of the central nervous system to begin the addiction. Not a lot of this nicotine or dopamine receptors on the muscle. So when you are smoking only a little bit, you have low concentrations, they focus on the brain. When you have a lot or high concentrations, then it is able to land both on the brain and on the muscles to affect them. Sorry. You can have in the brain too much confusion, seizure, coma, in the muscle, twitching, paralysis, or no breathing. That would be nicotine toxicity. I know many, many years ago there was a story out, and a toddler had, unbeknownst to the parents, been going into the ashtrays and eating their leftover cigarettes. And he actually died of nicotine toxicity because it built up in your system. Other than that, I don't know any adults that deal with the confusion seizure coma. So tobacco, what is it? Well, it's made from the tobacco plant. It contains small amounts of nicotine. So the cigarettes themselves are made from the leaves that are dried and chopped up very, very finely. Inhaling the tobacco smoke causes it to enter your bloodstream quickly and is kind of a stimulating effect. And then, like I said, at high concentrations, nicotine is poisonous and is used as an insecticide. So if it can be used as an insecticide, that's kind of freaky, I think, for us to be using tobacco. All right, sorry. How does it damage your health? Let's look at this picture. Okay, so they want to know is there a link between smoking and lung cancer. So if we put lung cancer on the graph, we can see that in 1920, you had a few cases, 10 maybe, and then it's increasing, and then there's an exponential rise up to, in 1960, you had 175 lung cancer deaths, and it peaked and kind of went back down. So right around 175, 180 by almost 1980 had died from lung cancer per 100,000 people. So I would take the 175 times 100,000. It's like what, 1.75 million? A lot of deaths. If you throw cigarette consumption in here as well, you notice it's mimicking the lung cancer trend in red there. And they're showing in the 1900s, almost 1,000 cigarettes were smoked per person per year. And then as you get this exponential rise again from 2,500 to 3,500, and then it kind of peaks at a little over 4,000 cigarettes a year in 1940. So you can see as the cigarette peaks, then 20 years or so later, you've got not so good events. All right, this is kind of cool. So what's in cigarette smoke? What chemicals are in there? So let's watch the video here. It says cigarette smoke contains tar. Hold on. Okay. Cigarette smoke contains tar, a dark sticky substance that collects in the lungs. And if I push play, so we've already got the tar here on the bottom. Let's click play for the next step. So the universal indicator, which is here on the right, the green solution, it's a neutral solution. And as the smoke is drawn through this, it goes from neutral to acidic. As carbon monoxide and nicotine will bubble through. And so it's turned pink, showing you it's acidic. So red blood cells are normally saturated with oxygen when they leave the lungs. So you have capillaries, you have red blood cells going through, they're red and purple. Then you have, here's our score sheet, kind of, sort of. So anything that's got two red is oxygen, one red and one black is carbon monoxide, and two red, one black is carbon dioxide. So the oxygen is supposed to be leaving the alveolus, going into the capillaries, and the deoxygenated blood, the carbon dioxide and carbon monoxide, leave the capillary and go into the lung to be expelled. All right, so the carbon monoxide in the cigarette smoke prevents the red cells from picking up oxygen, which is a bad thing. But that's how you end up with things like emphysema, bronchitis, and so forth. Now, here's a picture of, let's see, I'm going to restart it, of a smoker and a non-smoker lung. Okay, so in a non-smoker's lung, you don't have cigarette smoke because you're a non-smoker. So what you see here on the right is throat cells, and you've got the cilia, so little hairs that help move things, and then a pretty bright green mucus, so good color and everything. So what happens, bacteria and dust from the air are trapped in the mucus, and then the cilia, with their rhythmic beating, move the mucus out of the lungs. So you can see that they're pushing the mucus up out of the lungs. That's what good lungs do. Smoker's lung, though. If you notice, the cilia, there are fewer of them, and the ones that are there look kind of sad, and the mucus is not even a bright green color. So what happens is the tar in cigarette smoke paralyzes and kills the cilia and changes the mucus secretion. So it's no longer bright because the cilia are damaged. They don't have the strength to move the mucus out, and kills, like I said, kills all the cilia out. So this is where the smoker has to cough to remove the mucus from their lungs more easily. So that's where you get that phlegmy hack, that barking cough type thing. All right, pregnancy and smoking. It's a risk for mother and baby. So pregnant women who smoke are at increased risk of miscarriage, fetal death, detachment of the placenta, premature labor, and then babies exposed to smoke during gestation are at increased risk of sudden infant death syndrome, limb deformities, and low birth weight. So miscarriage, fetal death, I think that depends how much or how long you smoke. Detachment of the placenta is not strictly related to smoking. There are different things, but basically if the placenta detaches, then the baby doesn't get the oxygen and everything that it needs, and it can send you into premature labor as well. So, which set of lungs do you prefer? Here's an up-close picture. Again, on the right is the one that's got all the tar and stuff in it that's just nasty, and it's hard. The one on the left is soft and kind of squishy. So now we're switching gears again to depressants. They slow down the activity of the nervous system by reducing the release of neurotransmitters at certain spots in the brain called synapses, which are the junctions or the gaps that the neurotransmitters have to cross. Results in sleepiness, reduced anxiety, but if you have too much, it can lead to addiction. Common depressants include alcohol, solvents, and barbiturates. And excuse the typo in that. Some depressants, such as heroin, also help reduce pain, which is why when you see people on heroin, angel dust, some of those, they're very violent and they don't seem to feel any pain just because their pain transmitters are kind of shut down. So what is alcohol? It's a family of related substances, but most commonly refers to ethanol, which is the active ingredient in alcoholic drinks. Don't confuse this with the ethanol that's added to our fuel in the summertime in Arizona. That ethanol helps reduce the greenhouse emissions. You don't want to drink it either, but alcohol, quickly absorbed into the bloodstream. We mentioned this before, and it has an immediate effect on the central nervous system. The effects vary from person to person, such as the rate of consumption, level of food or water intake, age and gender, and body weight or body fat. Whenever, good rule of thumb, although none of you are, probably only a few of you are old enough to drink, make sure that you're taking a glass of water for every alcoholic beverage. That helps dilute it, helps it get out of the system faster. And I believe in here it also talks about being dehydrated when you're drinking. So short-term effects of alcohol cause you to feel relaxed, less inhibited. So therefore it appears sometimes to stimulate people. However, the more you drink, the more of a depressant effect it has. Your reactions become uncoordinated and you have impaired speech. It is a diuretic, which means it causes more urine to be produced than normal. This can lead to dehydration, which contributes to a hangover, hence drinking a glass of water with every alcoholic drink. Helps with the hangover, although I'm not promoting that, but it does help your system, helps you not have some of these side effects. It also makes blood vessels dilate, which leads to heat loss. You can feel colder. Long-term effects of alcohol on the liver, because it's metabolized by the liver. Heavy drinking will damage the cells, causes them to produce fibrous scar tissue, which blocks liver function. This is called cirrhosis, which I believe this is another either project or discussion question. Heavy drinkers are also at risk for increased risk of cancer and damage to the brain, kidney, and immune system. So alcohol is not good in really any amount. The more you drink, the worse the results. So does it really matter how much you drink? Well, it's thought that 10 to 18% of patients who visit the emergency room are there for alcohol-related reasons. I had a friend of mine who worked in the hospitals, and they always knew when the football game ended because all of a sudden the emergency room would be flooded with injuries. That would be alcohol related. So why does it increase the risk of accident or injury? Well, slows down your reaction times, gives a false sense of confidence, and affects a person's decision-making ability. At high levels, alcohol causes vomiting, unconsciousness, and can even cause breathing to stop and lead to death. So we want to avoid this. Now, it also is, many things are addicting. Alcohol is one of them, drugs are another. Obviously, we know that. We've talked about that this whole presentation. So a person is said to be addicted to or dependent on a drug when they feel unable to stop taking it. There are two types of addiction: physiological and psychological. So physiological deals with the body. So you're compelled to take the drug to reduce or avoid unpleasant withdrawal symptoms. And so that's your body, the shakes and all that other stuff. Psychological addiction affects the brain. Person is compelled to take the drug to experience the effect it produces rather than to treat withdrawal symptoms. So they're doing whatever the addiction is to feel good, to feel better. They may think that they think more clearly, they're more creative, that type of thing. It's not the truth. All right, last slide. So addiction is a condition that results when a person ingests a substance or engages in an activity that can be pleasurable, but as you continue using or acting, it becomes compulsive and you no longer feel the joy. It also will interfere with ordinary life responsibilities, and because you're addicted, you may not be aware that your behavior is out of control and causing problems for yourself and others. The brain reward center picture over here, you've got the normal brain upper left, has high dopamine, so normal pleasure and interest, and the brain on the right, brain of an obese person, has a yellow amount, so mainly the medium dopamine, so difficulty feeling joy or pleasure, hence probably the reason that they're eating more and becoming obese. Then on the bottom right, brain of an alcoholic, difficulty feeling joy or pleasure. Those pleasure centers are also smaller compared to the normal brain. And even the brain, the way the brain is set up, if you look, there's more holes and it's not shaped the same. Then the brain of a cocaine user also has a lot of yellow, so difficulty feeling joy or pleasure, but some green is working in there as well, which is lack of pleasure. So it reduces the feeling of pleasure. So that is your addiction and your addiction PowerPoint. Hope you enjoyed it. Please take the exit ticket and submit that. Thank you.